Back, let's try this one again. The COVID-19 infections have climbed for a second day in a row. More than 14,700 new cases have been recorded in the past 24 hours. 384 more people have died. Let's speak to the co-chair of the Ministerial Advisory Committee, Koleka Mlisana. Prof, thanks for your time. Let's hope we get it right this time around. So I was asking you about the seesawing effect that we're seeing with these numbers. Any idea why that's happening?
Yes, thank you. Good evening, Shahan, and good evening to the viewers. Sorry about that small hiccup. Yes, I was just saying, firstly, when you're looking at numbers, we always need to look at where are we in the week, how far are we from the weekend? Because obviously we know that during the weekend, the testing is less, and then this usually stabilizes by Tuesday, Wednesday. So really, when you're looking at today's numbers, in fact, even yesterday, we had a lot more. So it is of concern that we are seeing this increase in cases. And therefore, the question is, if, for instance, we're looking at the third wave and you just look at the different provinces, we can see that where we're only seeing this, typical, bell-shaped where we are going down, it is really with the Gauteng province and Limpopo. But otherwise, all other provinces are still on the increase. And so, which therefore means they really have not, it looks like they have not reached the peak. For instance, if we're looking at Western Cape, we had thought that they had reached the peak, but we're seeing the numbers going up again. And what we have seen, especially, for instance, in the Northern Cape, where really the epidemic and the wave has behaved in a very unusual manner. When you come and you look closely, we are realizing that actually, apart from the fact that we are seeing differences between provinces, there also are differences within districts in the provinces. For instance, specifically in the Northern Cape, the districts that are now responsible for the high numbers had not really gotten onto the third wave. So it looks like there are differences in how this wave is coming in and how the infections are occurring. It therefore just really says to us, we are not over the third wave yet, and we still need to continue to be vigilant.
So then, in your expert opinion, should we have moved back to lockdown level 3?
Well, we are on lockdown level 3 at the moment. We have not moved. And so, because if you're looking at overall, we have been seeing a good decline. But I think what is currently happening now, it is something that we need to have a closer look and tighten. Maybe people have gone back to relaxing now and ensure that we tighten, the non-pharmaceutical interventions. And so really, I think for me, the message we need to bring around is that we're still seeing a lot of transmission happening. We're still seeing a lot of new infections, new cases coming up, and people need to continue to be vigilant.
So would you recommend that we see a tightening of restrictions again?
We probably need to look and watch for the next few days, Shahan, and see what's happening. Remember, we don't really take numbers on a day-to-day basis, but want to look at the 7-day moving average. So we do want to look to see what's going to happen, in the next, 7-10 days. Only then can we tell, are we really definitely increasing everywhere across the country, or it was just a matter of the last 2 days and we're going to see another decline.
And then let's talk about the death rate here. We saw it at over 500 yesterday, over 300 today. It is worrying, isn't it? Is there any indication as to why we're seeing more deaths this time around?
Well, obviously, when we're looking at deaths, firstly, it is always a matter of what is getting reported and when are those reports coming through. And so we do know that actually, if we're looking at the third wave, we have had a lot more infections than we saw in the previous first and second waves. And so that is why, therefore, it is not surprising to see more deaths. But if you're looking at overall, we also, looking at deaths, we also have been concerned, obviously, when we're looking at the excess natural deaths, which have continued to rise. But then in fact, I was just looking at the report of the, natural deaths, and, what they have seen in the last 7 days, there has been a decline. But still, obviously, it is way too early to tell, because yesterday we saw more than 500, today we're sitting at 300. And so even as far as deaths are concerned, it's going to be a matter of monitoring that closely. And the question is, we're seeing these increases in reported deaths against a backdrop of actually reduction in hospital admissions. Because really, if we're looking at the data of admissions, there has been decreased numbers, over the past 4 weeks. And so why are we now seeing an increase in the deaths? That we need to take a close look at. And I really am not sure what could be causing that.
Yeah. So let's move on to vaccinations. There's major concern about people not showing up to get vaccinated. Yet there are polls that show that people are optimistic about getting the vaccine. So those are not correlating. Why do you think this is the case?
Yeah, Shahan, I think everybody now is very concerned with the vaccine hesitancy, because, we are just not getting the numbers to come in for vaccination. We have got enough supply of the doses, but the numbers, we were hoping that by now we would be way over beyond 250,000 vaccinations a day, but we are not getting there. And we really need to ask ourselves, are we not getting the message through? Maybe the issue is that we are not able to package the messaging for people to understand why it is important to vaccinate. And so I think for me, what we really need to also look at doing now is how do we bring in the positive effects that we have seen with vaccination? We need to bring in those positive stories. We need to actually, for instance, if we're looking at Sisonke, what we have seen with Sisonke is that, for sure, when we're looking at the number of breakthrough infections, but then those that caused severe disease were far less. There was 94% of breakthroughs were mild disease, and 4% were moderate disease, and severe was only 2%. So these are the messages we need to bring forth, that post-vaccination, the disease is going to be mild in most cases. And we also need to bring in the effectiveness. We have seen, with Sisonke, with healthcare workers, that really there has been 71% effectiveness against hospitalization. And when it comes to deaths, as high as 96% of deaths have been prevented. So I really think we then need to tie in the positive effects we're seeing with vaccination with the messaging that gets across, so that people can begin to appreciate that really it's going to be important for everyone to get in to be vaccinated if we want to ensure that then we end up with less severe disease and definitely much reduced deaths. And we have seen this in Israel as well, in that if you're looking at the elderly, actually, the unvaccinated group is actually almost 8 times more likely to end up with severe disease. So really, there are benefits of vaccination versus those that don't get vaccinated. So I really think we need to find the way of communicating this such that the general person walking on the street understands the importance of vaccination.
So outside of convincing people, hesitancy, and obviously messaging from government, what about accessibility? Because that's a concern. We spoke to traditional leaders who say that people in rural areas really don't have access to the vaccines, and there's no way they can travel to faraway places to get the jab.
Oh, no, you're spot on. It's exactly, we need to bring that up as well. In that, for instance, we need to be having a mentality that says we need to take the vaccines to the people rather than the other way around. And I think there have been, especially in what we call the rural provinces, there really have been very innovative attempts to reach out to the communities where the traditional leaders have actually been part and parcel of deciding how do we really get this across to the people, and where we really need to ensure that we've got these mobile, vaccination sites that get to the people, whether it's going to be linked to specific events like, payday or pensioners day, or, linked with SASA activities. So we really need to make sure to see how best can we really bring, the vaccination to the people. We have seen how, the Eastern Cape and Limpopo have actually done well insofar as, getting the numbers, that we're looking at.
Yeah.
Though we still have got a long way to go, but I think we need to identify the provinces that are doing well and learn from those to improve, getting more people to be vaccinated.
Yeah. I've run out of time, but one last quick question. How's the new minister treating you? I know you were saying that the previous advice you gave to the previous ministers wasn't really listened to all the time. How's this relationship going?
No. I'm sure it's going to go well. I mean, the current minister has always been, has been the deputy minister. So we really are looking forward to meeting him, and we probably will be meeting with him next week. We've had chats now and again. So I'm sure we will get on very well. We're here to support the minister, to support the Department of Health. Yeah. We will see how it goes.
Hope it works out. Thank you so much for your time. Appreciate it. That was Professor Koleka Mlisana, COVID-19 Ministerial Advisory Committee.